Interface Video, in cooperation with Fairfield Federal, presents Fairfield Today. Brought to you by Fairfield Federal Savings and Loan, Fairfield Medical Center, Fair Hope Hospice and Palliative Care, the Frankie Smith Funeral Home, Fairfield County Adam H., Dagger Law, and the Fairfield County Board of Developmental Disabilities.
Hello again, friends, and welcome to Fairfield Today. A little different scenario here. We are on the road. Normally we're, of course, telecasting from the lobby downtown at Fairfield Federal for Fairfield Today, but a few times a year, not all that many, since we've come back. I mean, this may be the first time since back in March or so when we came back, a long time. We don't go on the road that often, but we had a real opportunity here today to come out to the River Valley Mall to talk about all things COVID, which is pretty much every show we've talked about all things COVID, no matter who the guest has been. But we're out here now talking with Larry Hanna, who is the administrator of the Fairfield County Health Department. First of all, Larry, thank you for joining us. If I think about people who've had a busy year, I don't know anybody more busy than perhaps you in this past year.
Well, the entire health department has been extremely this past year, extremely busy. I can't imagine a much different year than last year. Sure. So yes, you're absolutely right. This last year has been extremely busy. I've been at this health department for 16 years now. 5 years ago, we went through the botulism outbreak,
and I, along with all of you, probably thought that it doesn't get any worse than this.
Absolutely. After that, I thought, wow, it sure can't get any worse than that. Boy, if I would have known back then what was ahead of us. But
piece of cake.
Yeah, it was a piece of cake. Botulism was a piece of cake. But we have a great bunch of people that work at the health department. They are really sharp. They're hardworking, dedicated folks, and we're very fortunate to have them.
Well, to tell you now why we're out here, we're with Larry Hanna, who's the administrator for the Fairfield County Health Department. We're out here at River Valley Mall because now they have a couple storefronts, and they're located behind us, and we'll get some shots of that. You'll be able to look at that as we move on. But this is now where the Fairfield County Health Department is conducting the vaccinations that they're doing. For a long time, they were at the fairgrounds, and that's where I went there with my wife, and we had her shot there, and it was a super operation. But now it's moved out here for the future, and it's here now. And I have to think that one of the reasons you moved out here is, judging by the lines of people I see out here and going, you can get a lot more people through here.
That's true, Paul. At the fairgrounds, we were able to get through about 400 people a day. That was a busy day for us, mainly because we ran everybody through in their cars, and there were only 3 lanes in there.
Right.
Out here, we can set up as many as 10 vaccination stations. So we think we've done several days where we're at 800 people per day. So, and we actually think we can get that up closer to 1,200 after a little while.
Now, I haven't had occasion to use this scenario here. You come in, it's pretty much the same thing as that you had at the fairgrounds, except that was drive-through. This is walk-up. But I will say this, with the amount of staff you had out there, and it looked pretty labor-intensive to me. There were a lot of people in that building back there doing things, but it was a wonderful operation. You guys had it down to a science. We got checked in, drove in, got the shot, waited 15, got out. It was like a clock.
Yes, absolutely. Thank you. I appreciate that.
And this is the same thing here, only different?
It is the same thing here, only different. A little larger operation, of course. It requires more volunteers and more staff involved. So, you know, if folks would like to volunteer, you can get on our website and fill out a form to do so.
How great is that? People help out.
We really love to have volunteers.
So what you have behind us here are 2 storefronts.
We do.
What was here before? It was Kitchen Collection, which is the one we're sort of in front of now.
Yes.
And then there was another place beyond that.
Called Jolly Hoppers.
Jolly Hoppers.
Yes.
And the Jolly Hoppers is now where the actual shot is going on.
That's correct.
And then what, you wait in the line, you get checked in, how's it work? You fill out some paperwork?
So you fill out some paperwork, you show up at your time, fill out some paperwork, it's just a 1-page form, and then we'll check you in, we'll vaccinate you in the Jolly Hopper side.
Okay.
We have up to 10 stations working all at one time, and then we'll bring you over into the kitchen collection and have you wait for 15 minutes to make sure you don't have any reaction. And by the way, we've given over 7,000 shots last week and haven't seen any kind of reactions at all.
Isn't that good news?
Yeah, it's very good news.
Good news.
Yes.
So how people get registered for this, as I remember it, because I've heard people say, well, I just want to, not here, but we're at a drugstore or wherever they went. I just waited, and then eventually they said we have an opening. But here you need an appointment.
You need an appointment, yes.
So,
you don't have
you need to phone. You fill out a form online, as I remember.
You'll get on our website and you'll fill out a form. It's called Vaccine Management System now. The entire state's required to use that, and we're just kind of switching over. We're in the process of switching over. We've had a few little snafus,
sure,
which you do with everything, but you'll need to register on that, and then you'll get updates. So for instance, if you're 30 years old, you're not eligible yet.
We're not that far down.
We're not that far down. We're doing folks that are 50 years old and up, and people that are under 50 that have some health conditions at this point. So let's say you're registered and you're a healthy 30-year-old person. You go ahead and get registered, and you'll get texts and updates when your time will be, when that group will be vaccinated in the future. So, and then you'll receive a call or a text or something like that, or an email, and that's how you'll get scheduled.
And what would you say is a percentage of people now that are saying yes to this? Are you seeing a lot of people saying no? Would you guess that, or can you tell?
It's hard to tell. I'm thinking at this point we're seeing a lot of people saying yes, because we still have a huge demand for it. Huge demand. I'm very pleased.
Okay. So people get registered, they come in and do this, wait 15 minutes and move on.
Yeah.
And you're still doing, is it the Pfizer you're doing?
Actually, today we're doing Moderna and Pfizer shots, and those are both two-shot series.
Two-shot situations.
Yes.
Now, the third one we've heard come out is J&J, Johnson & Johnson.
Yes.
Which the big revelation there was, of course, it's a one-shot thing,
sure,
which from a logistics standpoint here would be far easier for you, double your capacity, I
Correct.
guess.
Yes.
So
just
you have
shot.
some of those, and you think that may be used in the future?
We do have some that we're going to be using later this week. We have some scheduled appointments for those already. Yeah.
Now, when this show airs here, probably it will have been, let's say, 13 months that all this started. And we already talked about what a heck of a year that's been. But when you think back to how this all began and where it was, what was the first indication to you, or who called you, or when did you know that there's something going on here that I need to be aware of?
So that's a great question. So we have a full-time emergency preparedness person at the health department. It's a grant-funded position. Okay. And they always have a lookout for things like that.
All right.
We have a pretty good idea 2 or 3 weeks ahead of time that something's coming. You don't often know, okay, it's going to be as big as it is this time, but something's in the mill, so you need to keep watch for it.
The first time I realized that this was a big deal, because you see things on TV, you hear things, well, we're getting a breakout here and in this state. And the first thing I remember is when the governor canceled the Arnold Classic in Columbus. In my mind, this is big, because that is the moneymaker in Columbus. It would be like the festival or the fair down here. It's huge.
It was huge.
And when he canceled that, I knew something was up. And so from that point on, I'm sure your phone is rung nonstop.
It has. Our phone has just rung nonstop with COVID since then. There's been days where typically we'll get 400 phone calls. It's just
400.
Yeah, it's just unbelievable at times.
And now people are probably calling about how do I get the vaccination.
Absolutely.
You probably get a lot of those.
Yeah.
And I will say that I've made a few of those calls myself about my wife getting scheduled for that. And I just want to comment on your staff, and you gave them props earlier, and I want to do that too. I've had several calls with some of the young ladies who I've called, and they've eventually called me back, and they have been so nice. And I'm sure they say the same thing 150 times a day, but they were so nice, and your staff has just done a tremendous job, I think.
Thank you, I appreciate that.
Yeah, I mean,
for them, I appreciate that.
And I would imagine when I look in there now, I remember out in the fairgrounds you had, I think, 3 lanes going in there where nobody got out of their cars. We all stayed in our cars. And you had 3 lanes, but it looked labor intensive. But I would imagine in here now, if you say you have up to 10 stations open, you probably have a lot of bodies.
Yeah, absolutely.
Yeah. Have you had to hire anybody through all this?
So one thing that's really been beneficial for us is our partnership with the county commissioners. They have been wonderful to work with. It's the same for Fairfield County EMA with us. That collaboration between the 3 agencies has just been wonderful. I don't know what we would have done without the other 2 partners in this, to be honest with you. But to answer your question, we've also got right now, the High Department of Health has hired on some vaccinators that we have on staff right now. It's no cost to the health department. I think we have 8 of them here today. So they show up, they're here for 40 hours a week, no expense to us or the county, and it's just a wonderful benefit because it really helps us to do things like that. Because it is hard sometimes to find enough volunteers. Volunteers are wonderful, but it's hard sometimes to get volunteers to be there as much as you need them to. It's difficult, and we understand that.
Larry Hanna is our guest here. He's a Fairfield County Administrator for the Health Department, and I would say that almost without question, you've had tremendous interfacing with lots of other agencies in Lancaster, certainly at the city level, and we know at the county level, because we've already talked about how important the commissioners and everybody there was. But I'm certain you've had to work with nearly every entity in all types of government since this has started, and I'm sure everybody has looked to you for answers and lots of questions, but it's probably been interesting on your part to see how all this works together.
Oh, absolutely.
Because you've had to work with them more than you ever had before.
Absolutely, absolutely. It's been something that's actually it's grown into a county-wide effort, and it's good to see.
Yeah.
You know, to me, it's kind of similar to similar to a World War II experience.
Sure.
Everyone's kind of done their part for this. It's been a really good collaborative relationship with a lot of different partners.
You know, and I think back maybe even let's go back to the early stages a year ago now. Nobody knew what was going. We were stumbling. Do we wear a mask? Don't we? But now you don't see nearly as much, at least in my mind, nearly as much apprehension on wearing a mask, because before it was, well, you should, but you don't have to. Now, of course, you can't go in hardly anywhere unless you do wear a mask. But a lot more questions have been answered now. We know a lot more.
We do.
As we move on, and that probably changes day to day.
It does. There's a lot of information change, but one of the things that has been constant all along is masks have been beneficial. Social distancing has been beneficial. You know, there's always a debate of what type of mask is better than others, and there absolutely is some masks that are better than others. But overall, and you know, it's hard to say what type of mask is the best. Probably the N95 is the best, but it's the hardest one to find. But your cloth masks, they wouldn't protect as well, but they do provide some level of protection, and that's the important part.
Well, hang on to that, as they say. We'll circle back to that.
Okay.
Because I want to go more on the masks and some of that information there. But if you'll stay with us, we're going to take a break, and then we're going to come back. You good with that?
Absolutely. Thanks,
good.
Paul.
Larry Hanna with the Health Department's with us. We'll be back in just a moment.
Fairfield Federal. When it comes to our customers and our community, we go above and beyond to help. Our people make the difference.
We were retiring from Tucson, Arizona, and we made a retirement trip out around Ohio, having decided that's where we wanted to be. And we came across this town called Lancaster, and we fell in love with the downtown area, where the fountain is, and the memorials, and the flags, and all this stuff. And we looked around, and I said, there's our bank, right there.
There's something to be said about a community bank in your hometown.
Right. If you live in the community, you should do business in the community as much as possible. So it makes sense to bank with the community bank where you live. Fairfield
Federal is the bank to be at. If you live in this town, or any town actually, you want to bank at a local home bank. And the employees are happy here. They're conversant. Customer service is through the roof. There's nothing more you could ask for.
Personal or business banking, whatever you need, we take it seriously because we know you do. Stop by today at any of our 3 locations and see why the difference is clear. Fairfield Federal Savings and Loan specializes in banking that revolves around you.
Member FDIC Equal Housing Lender.
The Frankie Smith Funeral Home and Crematory in Lancaster and the Johnson Smith Funeral Home in Baltimore have a long and wonderful history of serving our community. Feel free to give us a call at 740-653-0652. Stop in and see us at either of our 2 locations, 405 North Columbus Street in Lancaster and 207 South Main Street in Baltimore. Respect for tradition, regard for change.
Welcome back to Fairfield Today. Paul Jasson with you, and again, we're on a road show today. We're out at the River Valley Mall, and we're at a storefront down, I think behind us maybe, is that Elder Bierman that was near us? Behind us, Elder Bierman behind us. But we're at a couple storefronts, but for our purposes today, it's being handled by the Fairfield County Health Department, and this is where you get your vaccine shots out here. So this is where pretty much everybody that's going to get a shot now, if you come through the county agency to get that, this is where you're going to come. It was the fairgrounds, it's now here. Our guest is Larry Hanna, who's again the administrator with the health department. And we talked about masks, and it seemed like forever, it's like everything else, we couldn't get enough masks. We could not get enough masks. I mean, PPE and things hospital needed, and everything was. Are we way past that now? Everybody can get whatever they need.
I don't know if they can get whatever they need, but we're certainly light years past where we were 10 months ago. Let's put it that way.
Yeah. And say from the hospital standpoint, I haven't had anybody on from the hospital to talk about that. But at its worst level, were they ever maxed out? Because you saw on TV places like New York, who again are light years away from us, and thank goodness for that. But hospitals were maxing out, they were running out of space, they were running out of ventilators, they were running out of everything at the worst moment. At what you would consider the worst moment here last year, was that ever an issue here, do you think?
So I know there was some period not too long ago, within the last 6 months, where the hospital was most of their COVID beds were very close to being full.
And they moved and made some more COVID areas,
they did.
right?
And there was a point where they were very close to being full. Unfortunately, we've kind of moved past that. People started doing the right thing better, wearing masks, social distancing, avoiding gatherings and things like that, and it's really helped in Ohio.
And I can remember I did talk to Jack Genoso, who's the CEO out there, and this was just after, let's say, we came back to doing the show about March, maybe a year ago now. We were just after, or maybe May, when we came back to doing, we were allowed to gather again now. And he was saying what really had hurt the hospital was they weren't able to have elective surgeries. They had to cut all that out, and I'm assuming that's all back online now.
As far as I know,
you know.
Yes.
So you come out here now. Let's talk a little bit more about this great place. You register online.
Yes.
Is it Fairfield County Health Department?
It's myfdh.org.
Myfdh.org. Good website. Tons of information on there. I mean, you can search the health department. You'll get it. You'll find it. But on there's an online application, and that's how you get registered to do all of this.
Yes, that's exactly right. Yes.
So you get online. You fill that out online, and then they'll give you a call. When your time is due? When your age group's available. Okay. Yes. And we're down now to 40s? We're down into the 50 and up. Okay. And then we're ages 50 and under that have health issues such as type 2 diabetes or end-stage renal disease. Sure. So. And as we look back now, do you know what the total number of deaths in Fairfield County were? Not offhand, Paul. I apologize. No, that's all right. It would be on our website. Yeah. All that. Again, they have a wonderful website with tons of information. So they come out here, and how long would this whole thing take? And given that, there was a little line, it looks like it's kind of gone away now. Yeah. So you have to wait 15 minutes when you're done. So maybe expect a half hour plus or so? I would say a half an hour to an hour, worst case scenario. You know, when we first start, usually around 10 o'clock, we've got a pretty good line here, but after we're going for a while, we're down to like 8 or 10, 12 people. So, okay. And then it rolls pretty quick at that point. So, there are 88 guys like you in the state who became the gurus, and a job you never wanted, I'm sure, in your wildest moment. You never wanted to take on the responsibility that came your way with all this. But as you look back over better than a year now, certainly for you, more than a year, well more than a year now, is there anything now that still keeps you up at night? So I think we've made great progress over the last year. I'm pleased that people are doing the right things as far as wearing masks and social distancing, because I've said that multiple times. And folks are really starting to take the vaccine. The things that concern me
at all at this point are the variants in the United States.
That's something new that's
That
just
is
sort of
something new.
There's a UK, and I think there was a South American, maybe another one.
There's multiple variants.
And probably more coming.
Yeah, and what those are genetic mistakes that could cause, when the virus mutates, it causes mistakes, and those are called
in the DNA.
Correct.
Right.
And those they could cause more disease, could cause more illness. It's to be determined. We just don't know at this point.
Now, if you look over in the UK, is it going wild over in the UK right now?
Well, they're not vaccinating at the rate that we are in the United Kingdom, and I think that's a lot of it.
How about South America? I heard once that they were going way down, that things had gotten a lot better. Now, I don't know. That may have been prior to this new variant.
And that's quite possible, yes.
Yeah. So worldwide, do you think things are being handled pretty well?
Certainly a lot better.
CDC? They'd be ultimately your bosses.
CDC is doing a very good job. They have a tough job.
Yeah.
I think they're doing a very good job. I think our governor's done a very good job.
That was going to be my next question.
I think the governor's I certainly wouldn't want the governor's job. I can tell you that. He's made some very difficult decisions.
When you talk about things that keep you up at night.
Boy, that's for
multiply your job by 88.
At least. Yeah. At least, yeah.
Yeah, so again, and you've had to do that here. You've had to make probably unpopular, but certainly at the very least difficult calls. What were some of the things that you had to do that you wish you didn't have to do? Was that close some of the businesses and close down? Because much of this stuff is on you, the health department, and you in your position. You made a lot of calls for the county.
We did make a lot of calls for the county. You know, we did some advising for the businesses as to how they should handle those businesses, especially that first 2-3 months. We made a lot of calls, and it's difficult to make those calls. Things like that were difficult to do.
Now it looks like things are on the opening up stages. You see more of that as you folks are in restaurants all the time making other decisions in restaurants that you have to do as a health department. But as you see businesses and things now, it looks like maybe slowly we're coming out of this a little bit.
I definitely think, I feel good about what's happening.
Yes.
And you know, I feel good about it. I think we're coming out of it. Our numbers continue to drop in the United States and in Ohio. I know the governor says if we get down to a certain level, he's going to lift all restrictions.
Yes.
And we need to be careful about that. We're certainly heading out of this, but we could slip back into it too if we're not very careful.
And I think that's what everybody in your position, and certainly the governor, you can't let down now. I know everybody is fed up. Everybody's had enough. We've all social distanced. We've all done this. Everybody, it's easy to pile on the governor and say, you've got to let us go back. What do you mean July when the president says July 4th? How can you, blah, blah, blah. We all know that. But I think being vigilant is probably still a key. You can't not wear the mask. You can't not social distance out of your little group.
Absolutely right. You know, I look at it kind of like a football game. We're 10 yards from the end zone. We're right there. We just have to keep focused that last few minutes, those last few months, and we'll get there. But we just need to stay focused.
And that's probably where it becomes difficult, because everybody's been doing this in some manner for a year now. As a civilian. We've all been wearing masks. We've all been fighting the good fight. And now everybody is, as weather breaks, it gets nice outside, it's springtime, you begin to think about more things in terms of things that perhaps could go on here. Maybe the festival will come back in some manner. We know the fair will come back in some manner because the governor has said now the fairs can go ahead. So there's lots of things changing for us, but I guess the key you would say is don't let your guard down yet. Don't let your guard down, but I think it's good that the cases are starting to go down right now for the time of year, because we're right into almost to the spring season. That'll get us outside more, get a little more distance from us, from each other, and it'll help. That distance outside and the airflow outside will certainly help with the transmissions, I believe. I guess that's a perfect scenario. Go out into the open parks where there's nobody around, maybe just you and your spouse, and go out and walk around. You don't need to wear a mask in that scenario. That would be better for us. Absolutely, it will be. Yeah. Absolutely. So we're getting close. I like the football analogy too. That maybe it's close, but we're not there yet. So you can't. Certainly, it's right there in our grasp. We just have to finish that last. Don't refuse to wear a mask. Don't go out and have massive parties. Don't of people not in your group, because we certainly see things that are happen out there. And again, we see states like Florida, a Texas who are opening, but again, those are warmer climates. I imagine a lot of that has to do with, say, the governor here, Kentucky, not opening up as much as it's been colder here and keeping people inside.
Forces us closer together.
Forced us to be together?
Yes.
Yeah.
I would imagine there's a lot of that used in factoring when to open things.
At the most critical time of all this in the past, how often were you in contact with the governor, or was his office calling you?
So we have a governor's liaison calls me 2 to 3 times a week, and every Monday morning health commissioners and administrators have a call with the governor every Monday morning.
Could I guess, in your case, you are Zoom meeting out?
I'm Zoom meeting out, I'm go-to meeting out, everything out.
Yeah. Have you had any face-to-face with the governor's office through all this, or are we still at the Zoom level?
It's at the Zoom level on phones. And actually, when you mentioned the festival, the Arnold Festival that was closed last year, we were in Columbus when that governor made that decision at a seminar. When the health department was.
Really?
Most of the health departments in Ohio were at that seminar. When the governor was there, they pulled the governor away, and they were talking about COVID. That's what the seminar was all about. They pulled the governor away for 15 minutes and brought him back, and that's when he'd made that decision.
Was this February, March?
Yes.
Yeah, back in there. So it's
back
been
in the spring.
Right about a year. I know the date now they're saying was just a couple of weeks ago, a year.
Yeah.
So you actually were up there, and that's where he announced it at your meeting.
Yep, that's where he announced it. That's
Could
where
you
he
hear
made
a
that
gasp,
decision.
an audible gasp in the room?
No, there were a lot
You
of
all
health
knew.
commissioners there. We kind of saw it coming.
So as you talk about it and you look around to your fellow health department officials throughout the state, is pretty much what's happening here, what's happening around the state. Things are getting better in a little bit, some probably more than others. Are any counties still in that, what was it, orange level or the worst level?
I don't think there are any counties in Ohio that are in the orange level now. There's still quite a few of the red, but there's certainly some indicators that we're going to get out of the red before too awful long, or the orange. But there are several indicators that we're still meeting, but our numbers keep coming down, so we're going to get out of that. We're going to go orange before too awful long.
Well, we're going to wrap this up, Larry, and again, thanks for joining us today. You've just been terrific. It's been good having you on, but is there just a final comment you wanted to make to folks? Maybe it's that football analogy, but any thoughts as this starts to go down, we're coming into April, it's getting springtime, it's getting more outside. Any thoughts you'd like to tell the public about what they should do?
Sure. So, I think we're months from looking behind at this thing.
Okay.
So it's important in these few remaining months that we have to continue to wear those masks. I know people get tired of me saying that. Continue to wear those masks, continue to social distance. Stay away from the big groups as much as you can. Try to keep your family unit as small as you can for a while, and get out and get that vaccine. If the vaccine is available, you take whichever one's available to you.
And that's what you hear. The best vaccine is the one that you can get first.
The one that you can get in your arm, that's the best vaccine you can get. They're all 3 great vaccines.
Well, Larry Hanna, who is the administrator with the Fairfield County Health Department, has been our guest. He's been the guru through all this, kind of guided the county with the help of lots of other government agencies, and people in this community have made some tough decisions and guided us through this. We thank you for all you've done. We appreciate your being with us. As we get through this, we'll talk, and we hope we can have you back on and talk about what it used to be like when we had COVID.
That'd be great. Without the mask, that would be great.
Without the mask, I'd love that. Larry Hanna from the Fairfield County Health Department with us. We've enjoyed being out here in the mall. Again, go to the mall or go online. You can find the information. myfdh.org is the address. Look it up, fill out the information, get online, get out here and get tested if you're coming through the county. This is the way to go. And again, the best vaccine to get is the one that's available first for you. So we hope you do that. Thank you for joining us here in the River Valley Mall with the Health Department on Fairfield Today.
Interface Video, in cooperation with Fairfield Federal, presents Fairfield Today. Brought to you by Fairfield Federal Savings and Loan, Fairfield Medical Center, Fair Hope Hospice and Palliative Care, the Frankie Smith Funeral Home, Fairfield County Adam H., Dagger Law, and the Fairfield County Board of Developmental Disabilities.